Retinopathy. Introduction. Retinopathy is a progressive eye disease that affects the retina, leading to vision impairment and, in severe cases, blindness. It is commonly associated with chronic conditions such as diabetes and hypertension. Early diagnosis and management are crucial to prevent irreversible vision loss. Definitions. According to the American Academy of Ophthalmology, AAO retinopathy refers to damage to the retina due to disease, leading to vision problems and potential blindness. According to the World Health Organization, WHO, a pathological condition affecting the retina, often caused by vascular, metabolic, or degenerative disorders, leading to visual impairment. Risk factors. 1. Agent factors. Hyperglycemia, uncontrolled diabetes leading to diabetic retinopathy. Hypertension, increased blood pressure damaging retinal blood vessels. Dyslipidemia, high cholesterol contributing to vascular damage. Autoimmune disorders, inflammatory conditions affecting the retina. 2. Host factors. Age, elderly individuals at higher risk. Genetic predisposition, family history of retinopathy or vascular diseases. Pregnancy, gestational diabetes increasing risk of diabetic retinopathy. Smoking and alcohol consumption, increases oxidative stress and vascular damage. Obesity, contributing to metabolic disorders affecting retinal health. 3. Environmental factors. Occupational hazards, exposure to radiation, chemicals, or high-stress environments. Poor access to healthcare, delayed diagnosis and treatment. Nutritional deficiencies, lack of vitamins A, C, and E impacting retinal health. High UV light exposure, sunlight-induced retinal damage. Etiology. Retinopathy occurs due to damage to the retinal blood vessels, leading to leakage, ischemia, and structural changes. The primary causes include diabetic retinopathy, caused by prolonged high blood sugar levels leading to retinal vessel damage. Hypertensive retinopathy, high blood pressure causes thickening and narrowing of retinal arteries, leading to vision problems. Retinopathy of prematurity, ROP affects premature infants due to abnormal blood vessel development in the retina. Central serous retinopathy, fluid leakage beneath the retina due to stress, steroid use, or unknown factors. Classification of retinopathy. 1. Based on etiology. Diabetic retinopathy, DR, caused by prolonged high blood sugar levels damaging retinal blood vessels. Hypertensive retinopathy, due to chronic high blood pressure leading to retinal vascular changes. Retinopathy of prematurity, ROP, occurs in premature infants due to abnormal blood vessel growth in the retina. Radiation retinopathy, develops after exposure to high-dose radiation therapy. Toxic retinopathy, induced by medications or toxins affecting the retina, example hydroxychloroquine toxicity. 2. Based on severity. Mild retinopathy, early stage damage with small retinal changes but no significant vision loss. Moderate retinopathy, increased vascular damage with potential vision disturbances. Severe retinopathy, extensive vascular abnormalities, hemorrhages, and high risk of blindness. 3. Based on pathological changes. Non-proliferative retinopathy, NPD, are characterized by microaneurysms, hemorrhages, and retinal edema without abnormal new blood vessel growth. Proliferative retinopathy, PDR, advanced stage where new, fragile blood vessels form, increasing the risk of bleeding and retinal detachment. 4. Based on associated conditions. Central serous retinopathy, CSR, caused by fluid accumulation under the retina, leading to temporary vision loss. Sickle cell retinopathy, related to sickle cell disease, causing vascular occlusions and retinal damage. Autoimmune retinopathy, results from immune-mediated retinal destruction, example in lupus or paraneoplastic syndromes. Pathophysiology. Chronic disease, diabetes, hypertension, prematurity. Down arrow. Retinal blood vessel damage, hyperglycemia, high BP, or ischemia. Down arrow. Increased vascular permeability, leaky capillaries leading to edema. Down arrow. Capillary occlusion, ischemia causing oxygen deprivation to the retina. Down arrow. Neovascularization, abnormal vessel growth in proliferative retinopathy. Down arrow. Retinal fibrosis and detachment, severe cases leading to blindness. Clinical manifestations. Blurred or distorted vision. Occurs due to macular edema, which leads to swelling in the central retina. Can make reading, recognizing faces, or performing detailed tasks difficult. Floaters or dark spots in vision. Caused by bleeding, vitreous hemorrhage, from damaged retinal blood vessels. May appear as moving black dots, cobwebs, or shadows in the visual field. Difficulty seeing at night. Poor blood circulation in the retina can impair adaptation to low light conditions. Night blindness may indicate advanced retinopathy, affecting rod cells. Sudden vision loss, in severe cases. Occurs due to retinal detachment, massive hemorrhage, or severe macular damage. May be partial or complete, depending on the extent of retinal involvement. Eye pain or redness, in cases with hemorrhage or inflammation. May be present in proliferative retinopathy when abnormal blood vessels rupture. Inflammatory changes or high intraocular pressure can also contribute to discomfort. Diagnostic evaluation. History taking, assess diabetes/hypertension history, vision changes, and risk factors. Ophthalmic examination, visual acuity test, slit lamp examination, and dilated fundoscopic exam. Fluorescein angiography, dye-based imaging to assess retinal blood flow and leakage. Optical coherence tomography, OCT high-resolution imaging to detect retinal thickening and edema. Tonometry, measures intraocular pressure to rule out associated glaucoma. Medical management. Glycemic control. Managing blood sugar levels is crucial for diabetic retinopathy. Insulin or oral hypoglycemic drugs, such as metformin, help regulate glucose levels and slow disease progression. Blood pressure control. Hypertensive retinopathy is managed by controlling blood pressure. Antihypertensive medications like beta blockers, ACE inhibitors, or calcium channel blockers help prevent retinal damage. Anti-VEGF therapy. Vascular endothelial growth factor, VEGF, inhibitors like ranibizumab and bevacizumab are injected into the eye. These drugs reduce abnormal blood vessel growth and leakage, improving vision in conditions like diabetic retinopathy and macular degeneration. Corticosteroid injections. Steroid injections are used in cases of macular edema to reduce inflammation and swelling. They help stabilize vision and prevent further retinal damage. Surgical management. Laser photocoagulation. A laser is used to seal leaking blood vessels in the retina, preventing further fluid leakage. It also helps reduce abnormal blood vessel growth in diabetic and hypertensive retinopathy, slowing disease progression. Vitrectomy. This surgical procedure removes blood clots, vitreous hemorrhage, or scar tissue from the vitreous gel inside the eye. It is performed in severe cases of diabetic retinopathy where bleeding or scarring obscures vision and threatens retinal health. Retinal detachment surgery. If retinopathy leads to retinal detachment, surgery is required to reattach the retina. Procedures like scleral buckling, pneumatic retinopexy, or vitrectomy help restore vision and prevent permanent blindness. Dietary management. Antioxidant-rich diet, include leafy greens, carrots, and citrus fruits to support retinal health. Omega-3 fatty acids, found in fish and flax seeds, helping reduce retinal inflammation. Controlled sugar intake, essential for diabetes management to prevent progression. Hydration, maintain adequate water intake to support eye hydration and overall health. Nursing management. Nursing diagnosis, risk for impaired vision. Related to retinal damage, macular edema, or hemorrhage in retinopathy. Interventions. Monitor visual acuity regularly using Snellen chart or Emsler grid. Encourage compliance with ophthalmic medications, including anti-VEGF injections. Educate the patient on warning signs like sudden vision loss or floaters. Promote optimal glycemic and blood pressure control to slow disease progression. Nursing diagnosis, risk for injury. Related to visual impairment and reduced depth perception. Interventions. Assist in creating a safe home environment by removing tripping hazards. Encourage the use of assistive devices such as magnifiers and well-lit surroundings. Educate on adaptive techniques for daily activities, such as labeling household items. Provide emotional support and counseling to manage frustration due to vision loss. Nursing diagnosis, deficient knowledge. Related to lack of awareness about retinopathy, its complications, and management. Interventions. Explain the importance of regular eye exams to monitor disease progression. Educate about lifestyle modifications, including diet, and smoking cessation. Teach patients about the significance of blood sugar and blood pressure control. Provide information on treatment options, such as laser therapy and vitrectomy. Nursing diagnosis, risk for social isolation. Related to progressive vision loss, reduced independence, and emotional distress. Interventions. Encourage participation in support groups for individuals with visual impairment. Assist in connecting the patient with vision rehabilitation services. Encourage family involvement to provide emotional and social support. Facilitate referrals to low vision specialists for adaptive training and devices. Prevention. Regular eye examinations, early detection through routine screenings. Blood sugar and pressure control, maintain optimal levels to prevent vascular damage. Healthy lifestyle, exercise, a balanced diet, and avoiding smoking and alcohol. Protective eyewear, use sunglasses to protect against UV-induced retinal damage. Complications. Permanent vision loss or blindness. Retinal detachment. Vitreous hemorrhage. Glaucoma, increased intraocular pressure. Macular edema leading to central vision impairment. Conclusion. Retinopathy is a serious eye condition that, if left untreated, can lead to irreversible blindness. Early diagnosis, proper disease management, and preventive measures such as lifestyle modifications and routine eye check-ups play a crucial role in preserving vision. Multidisciplinary care involving ophthalmologists, endocrinologists, and nurses is essential for optimal patient outcomes.